Today we are going to go over the perfect plank. More than that, in this video you're going to learn why I think learning how to do a plank is so critical after a brain or a spinal cord injury. And of course, several different variations to ensure that regardless of where you're at in the rehab process, whether you're in your first few days and you're still learning how to roll, or you're in the very late stages and you want to get back to kind of that traditional plank where your body is completely straight and you're on your arms and kind of on your toes, you will see an exercise in this video that'll meet you exactly where you are at. If you're new to this channel, I'm Tara, I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to mobility, health, fitness, and mindset in the context of neurologic injury, with the end goal of empowering you with as many tools as possible to take ownership of your rehab and reach your highest maximum level. And with that said, if you really do want to take your rehab to the next level and you feel like just going to therapy a couple of times a week just isn't cutting it, we do have a gold membership program that will give you access to over 300 exercises that are specifically designed for neurologic conditions in a software system that is intended for you to be able to quickly and easily find the exact exercises that you're looking for based on whatever specific goals you are working towards. So link for that is in the description below, and I highly encourage you, just check it out. Click on the link. You'll see some examples of what those exercises look like and kind of how that software system is set up. But now back to today's video and the perfect plank. So why do I think a plank is so important? Really, what I mean by a plank is we're just going to talk about prone in general. So yes, a plank is the ultimate goal that I think everyone should be working towards. But really, I mean, just getting on your stomach is so important from day one. First and foremost, in most cases, everyone, when you're in the hospital, you're in a flex position. Whether you're in bed or you're sitting in a chair, you're in a flex position. So first and foremost, what a plank does, or getting on your stomach at all, is it stretches out those structures to ensure that when you do get to standing, if you're not standing yet, that you can stand with good posture and that you're not really fighting that flexed position because all your muscles have shortened on the front of your body. So that's number one, why I think planks are so important from the very beginning. The other reason is it is the best way to start weight bearing. Weight bearing on your elbows gives you good proprioceptive input into that arm, which is sending feedback or sensory information to the brain by kind of approximating that shoulder joint or pushing that arm bone into that shoulder joint. You are sending tons of information into the brain saying, hey, there's an arm over here. So prone on elbows is what I'm talking about in this case, and it is super important from the earliest stages. In addition to that proprioceptive awareness, is you are starting to strengthen the stabilizers in the shoulders. So there is kind of volitional movement where our brain or our cortex is sending commands to the arm to get it to move, and then there is kind of like subconscious, kind of involuntary, kind of stabilizing motions that we don't really give much thought to. And so let's say, for example, you've had a stroke that's affected the cortex of your brain. Well, you can really still start tapping into those kind of automatic stabilizing muscles, which will help to start initiating some movement in that arm if they're incorporated early enough. The other reason is that spasticity does set in, and once spasticity sets in, it's a little bit harder to get into this plank position because it's hard to get your elbow out far enough to get on your elbows. So I do think if you're in the early stages, the earlier you can start practicing this, the better. The other reason that I think planks are so important is because anytime you have support through your arms and your legs, and the midsection does not have support, you are strengthening all of the muscles around your core, which are critical for walking. You have to have a stable center in order to get your limbs, your arms and your legs to move efficiently. So that is another huge benefit of planks. Now, in this context, if you think about it, there are a variety of ways that you can have support through your hands and your legs and not your midsection without necessarily getting into a full plank position. So we are going to go through some of those when we get to the exercises, but that's what I'm kind of considering a plank for the purpose of this video, is anything where there's support through your arms and your legs and the midsection is kind of in space. So now, the most important challenge is for some people is that you don't know how to roll. So we're going to go into how to roll from your back to your stomach if you have hemiplegia. If you know how to do the technique, I almost can guarantee that 90% of people, even in the early stages, can roll to their stomach just by learning the appropriate technique. So we're going to go through that technique today. I'm also going to talk a little bit, if you're a caregiver, on how to help someone in the early stages roll from their back to their stomach, because with just a little bit of help, if someone's having trouble, if you just give them a cue in just the right spot, they'll easily be able to flip over onto their stomach. So I am going to talk about that. Then we're going to go into a variety of different positions so that anyone, regardless of where you're at in the recovery process, can start doing this kind of plank position. And then if you are someone who can already get on your stomach, we're going to go into how to get kind of prone on elbows, which would be the next progression, and then kind of all the progressions leading up to being able to get into a full plank position where your body is straight and just your toes are touching the support surface and your hands are touching the support surface. So we're going to go through all of the ways that you can build up to that position. And then also we are going to go through other ways that you can kind of get this same concept of plank, meaning you're getting weight bearing through your arms and you're starting to work those core muscles without necessarily having to get on your stomach. So people that probably can't get on their stomach are any of you that have a feeding tube, or maybe you still have a trach in. It's not contraindicated, but you definitely would want to work with someone if you are going to get on your stomach with either of those. So I wouldn't recommend doing it on your own. Again, if you have a trach or you have a PEG tube, or you've recently had a pacemaker implanted, those would be reasons why you wouldn't want to get into like a plank position. But we are going to go through some other things that you can do to kind of start working towards this without necessarily getting onto your stomach. So other variations that will kind of do some of the same things that a traditional plank will do, but without getting on your stomach. So now I'm going to switch over and show you a clip from a video that is part of our Gold membership program. So one of the first places you want to start when learning how to do a plank or learning the foundation of a plank is rolling on your stomach. So to roll onto your stomach, if you have hemiplegia, you want to start by rolling onto your strong side. A wedge does help, so you will see me showing it with a wedge in this video. And then what you want to do with your strong arm is just kind of prop yourself up on your elbow. You want that elbow to kind of get underneath your shoulder, and then from there it's pretty easy. You're just kind of letting your chest fall, allowing gravity to just roll you over. Now, if you are a caregiver who's helping someone, same setup, you want to roll onto the strong side, but then you as the helper can kind of reach your hand underneath their chest and grab onto their elbow and just pull the elbow back. And then from there, it's pretty much the same thing. It's very easy for someone, even someone who's really low level, to be able to roll. Stomach, come up onto your elbows, and then you're just going to squeeze those abdominal muscles and raise those hips up. And hold it as long as you can, and then come back down. So in the first tutorial in this plank series, we went through how to do a plank on elbows. Now before we move on to a real plank, which is doing plank on extended arms, this progression, what we're doing is we're learning how to kind of get in that position with our arms extended while gradually increasing the difficulty by moving those feet backwards. I highly recommend before attempting a full plank that you use this variation. And once you feel it pretty comfortable with that, then you're gonna slowly move your feet back. Now notice my shoulders aren't going back as I move my feet back. My shoulders are staying directly over my hands. And then I'm just slowly moving those feet back. Again, the lower the surface that your hands are on, the more difficult it's going to be, and the further you move your feet back, the more difficult it's going to be. And then you're just going to push up and raise those hips. Again, make sure those hands are right under your shoulders and stay really tight. You don't want to be arched down and you don't want your butt to be up in the air. We call that kind of quadruped position. But if you're really trying to get good at these planks, you want to press your shoulders down away from your ears. You want your hands directly under your shoulders, and you want to stay really tight through your core. So starting on your stomach, start off setting yourself up for success by putting your hands, starting them in the right position, which is right underneath your shoulders. Curl your toes under, and then you can kind of use your knees first to get part way up, making sure your form is good and your position's good. And then the very last step would be to lift those knees. So for this exercise, what I'm showing you is really a core stabilization exercise, but it is also an exercise that you can use to advance to eventually doing a plank. So basically what we're trying to do is really start the initiation or in the early stages of learning how to engage those core muscles. This is good in particular if you are someone who cannot get on your stomach. So this is a really, really good position, again, for anyone if you can't get into a traditional plank position in the early stages, learning how to engage those stomach muscles. So you want to start with your back relatively straight, and then you're just going to kind of push forward just a little bit, as much as you can, and still maintain the position, and then come back. These are making them a little bit lower, and then you'll push them out just a little bit further. And then again, you want to use your stomach muscles and almost feel like you're pulling your arms down towards your body to come back up, instead of using your back to just sit back out. Then once you get really good at that, you want to try not to bend at your hips. So you want to try and keep your hips straight, and your kind of now the pivot point is your ankles. So you can see I'm coming off the wall and my whole body's leaning forward and staying in a straight line. And then you want to pull those arms down to bring your body back to a vertical position. I hope you guys found that video helpful. If you want to see that full video, again, link to join our Gold membership program is in the description below. Also, if you have any questions and you just want to join us for our monthly lives, you can do that for just $5 a month. Link for that is also in the description below. So let's say you don't want access to all of the videos, the exercise videos, but you just want to join us monthly for those Q&A sessions, you can do that as well, and the link for that is in the description below. If you want to keep in touch with us throughout the week, I definitely recommend that you head over to Instagram and follow us on Instagram. If you're new to this channel and you haven't yet subscribed, hit that subscribe button and turn on that notification bell so that you will get notified every time I upload new videos. I enjoyed spending time with you all today, and I will see you in the next video. Have a good day.